Hey y'all, my name is Matt Hartshorne and I'm the performance scientist and physical therapist at the Banner Sports Medicine High Performance Center in Scottsdale, Arizona. In my role, I work with an interdisciplinary team supporting athletes from youth to the professional levels, utilizing screening and assessment tools to identify areas of opportunity to improve both performance and reduce injury risk. So injury screening is something I'm really passionate about, particularly when it comes to ACL injuries. And ACL injuries roughly affect 2 to 3.5% of our athletes and are even more concerning in military populations where the risk is up to 10 times higher due to the demands of their job. And even with our advances in surgery and rehabilitation techniques, outcomes are still often suboptimal, with re-injury rates ranging between 20 and 30% and long-term joint health concerns existing. And that impacts both readiness and can shorten athletic and military careers. So because of this, prevention remains really critical. While we know ACL injury risk is multifactorial, nearly 2/3 of these injuries are considered potentially preventable. And as clinicians and coaches, we tend to focus on the factors that we actually can modify. So with that in mind, we examined whether lower extremity strength and demographic factors could predict ACL injuries in over 5,600 military cadets who underwent baseline strength testing using handheld dynamometry and then were followed over the course of their 4 years at their service academy. And what we found was about 2% of them sustained an ACL injury. And of the 6 muscles we tested, only the gluteus maximus strength was associated with a lower risk of injury. In fact, it showed a 68% reduction in the odds of sustaining an ACL injury for every 1 unit of increase in strength. And these findings suggest and highlight not all strength is equally protective, which maybe explains why the glutes get so much attention. Turns out they're not just for show. In fact, what makes the glutes unique is that they influence the hip, the pelvis, and the trunk, allowing it to help control dynamic movements of the knee and reduce the stress on the knee. Additionally, what we found was that BMI was also a risk factor. With every 1 unit of increase in BMI, we saw a 9% increase in ACL injury risk. From a clinical perspective, these findings support using handheld accessible tools like dynamometry to identify meaningful strength deficits and suggest that clinicians and coaches consider adding glute max strength and BMI to their current screening to help enhance their ability to identify athletes at risk for an ACL injury.